Hello everyone, I'm Colton Lopez, and today I'll be presenting research done by Doctors Ann McKee and Clifford Robbins pertaining to chronic traumatic encephalopathy, or CTE. So to begin, CTE is a neurodegenerative brain disease, and it deals with tau proteins within the brain, which are essential to the structure and the function of neurons within the brain. When these tau proteins become hyperphosphorylated, they become p-tau proteins, and these proteins form around blood vessels within the brain and essentially tangle and begin to decay these neurons within the brain. As you can see here, this is a normal brain, structured well, looks very healthy. Everything is closed up here in the center and in the cerebral cortex. Here, it begins to form these dark spots and begins opening up. And this is a very advanced stage 4 of CTE, which there are only 4 stages. This disease is significant because of the mental, physical, and emotional changes that it causes within the person. It is also a very heartbreaking disease because it will change the characteristics and the personality of a person that is known to be caring, loving, and make them very aggressive, very irrational thinking, and very impulsive. It is also can only be diagnosed with post-mortem examination, so it cannot be diagnosed within a living person. And because it cannot be diagnosed within a living person, there is no cure for this disease. The neuropathological features, as we just discussed, the tau protein deposition. So the p-tau proteins that we discussed earlier begin to form around blood vessels, begins tangling the brain, the neurons within the brain, alters the functions of these neurons, and essentially break the brain down and slowly decays, which is why this disease is called a neurodegenerative disease, breaking down of the brain. Progression of the pathology, as it advances, these clusters of these p-tau proteins begin to move to parts of the brain which are more essential to our cognitive and motor, decision-making, memory. They begin in the cerebral cortex, move to the occipital lobes, and eventually the parts of the brains which will deal with aggression, motor symptoms, as we just discussed, cognitive abilities, and that's when we begin to see major changes within the person and their personality, their characteristics. The macroscopic changes. Advanced CTE is characterized by enlargement of the lateral and third ventricles, the hippocampus, and the amygdala. And the hippocampus and the amygdala, those are essential to our decision making and cause impulsiveness and irrational thinking once CTE moves into that area of the brain. So this is Dr. Ann McKee's 4 stages of the neuropathologic staging of CTE. In stage 1, here you can see the p-tau proteins beginning to form in areas around the brain, kind of in spots around blood vessels, which are tough to see here, but this is a little blue outline here in the middle. You can see it more here in the stage 2 section. Here's a blood vessel, and these p-tau proteins, these little red marks, are beginning to form in clusters now around the blood vessel rather than in spots in different areas here. And stage 1 will begin in the cerebral cortex in spots and will move within the cerebral cortex, but will begin to form clusters. And here you can see little spots up here where this is a microscopic view of this here, darker, bigger spots and clusters. Stage 3 is beginning to move downward across the brain. These clusters are becoming much more apparent in this microscopic view here. The blood vessels beginning to be overtaken, starting to form a lot more. And here in stage 4, this is complete decay. There's clusters all without the brain here. It's moving down. It's beginning to become much more apparent. You can see the dark brown spots. You can see the opening here in the brain and within the cerebral cortex and down towards the hippocampus and the amygdala, as we just discussed. So the behavioral symptoms: impulsiveness, aggression, and explosiveness. Now, within each stage, these symptoms are seen in different extents. Stage 1, they typically, someone who has CTE will be able to hide these to an extent. They're aware of their actions, their emotions. For the most part, they will have aggressive outbursts occasionally and explosive outbursts occasionally. But this disease mainly pertains, and this research predominantly pertains to former professional athletes. And these athletes played contact sports, mainly American football, and most American football players, especially professionals, have some sort of aggressive nature to them to begin with. So these symptoms can be tough to see in the early stages of CTE. Impulsiveness will obviously increase as you move into stage 2, stage 3, definitely into stage 4. Decision making becomes very tough for these individuals, which is why we see bad decisions being made by these individuals who have CTE. Same goes for aggression and explosiveness. They become much more quick-tempered as they move into the latter stages of this disease. And they also become less aware of the people that they're around, and are not afraid to show this aggression and this explosiveness. The cognitive symptoms. Memory loss is the first one that will become apparent. And even the person who has CTE will begin to notice that they don't have the memory that they used to. Obviously, this is something that you can hide. A lot of people aren't going to be able to tell what you're thinking. So these individuals will be able to hide their short-term memory loss. And as memory loss will progress, it will become much more apparent that this person is dealing with something else going on within themselves. Confusion. Confusion of where they are, what they're doing, who they are, and who they're around will begin will grow and will become much more apparent as you move into each stage, as well as the other symptoms. And lack of concentration. These people will not be able to focus the way that they used to. And when pertaining to professional athletes, concentration is a must. And this is why you see a lot of these athletes who have been found to have CTE in the later stages of their career and their lives. Concentration becomes an issue, and you hear teammates talk about it, coaches talk about it, much like Aaron Hernandez, and which Dr. Ed McKee has done research on. He later in his life, in his playing career, he became immature, which is ironic because as we age, we relate maturity to age. So that's just some of the ways that this disease will affect these people cognitively. Motor symptoms: loss of coordination. Here, the cerebellum of the brain deals with coordination, and as we saw in the images earlier, CTE will attack this part of the brain as well. So these people in the later stages of CTE will become less coordinated. And once again, when pertaining to professional athletes, coordination is a major part of their lives. They will have difficulty with speech, and they will also eventually develop issues swallowing food, water, something small, but something that is apparent that we can see. And like I said, this disease cannot be diagnosed through a scan in a living person, but some of these symptoms can be seen. So clinical data that was done by Dr. Robbins and Dr. McKee at Boston University The youngest athlete ever diagnosed with CTE was a 17-year-old high school football player. This person committed suicide. Their brain was researched, and it was found that they had the early stages of CTE. And also, there's a correlation between age and stage of CTE, and the main reason is because early in life you haven't lived long enough to develop into stage 2, stage 3, stage 4 of CTE. So older patients who have been found to have CTE are in stages 3 to 4, and the younger subjects are in stages 1 and 2. This is a shocking statistic here. 345 out of 376 former NFL players studied were found to have CTE, which is 91.7%. 376 former players studied is a massive number, and to find that 345 of them had traces of CTE is shocking. 63 out of 152 studied brains in people under the age of 30 were also found to have CTE. 75% of all CTE diagnosed subjects played American football at some point in their lives. Dr. Robbins and Dr. McKee's research is mainly pertaining to American football players, specifically professional athletes in general, but mainly American football players. And we see the correlation here with the National Football League players. 91.7% of the studied subjects were found to have this disease. Diagnostic challenges. We already discussed that it can only be diagnosed in post-mortem examination, which means it can only be seen in people after it is too late, after they're already dead. The personality changes, just like this disease, as a human, as a person, we also change as we get into stages of our lives, much like this disease changes us individually as it progresses as well. So it can be tough to distinguish between normal personality changes and personality changes that are linked to chronic traumatic encephalopathy. Contact sport athletes typically have aggressive nature to some extent. Aggression specifically here is being targeted because American football players especially have to have some type of aggression in their nature, and sometimes this aggression can be seen off of the football field and just in everyday life. So it can be tough to distinguish that aggressive nature being shown off of the field in relation to CTE changing personality within the subject. There's no direct correlation to anything other than repeated blows to the head. This disease is not linked to emotional abuse. It's not related to how the subject was raised. It can be related to physical abuse and repeated blows to the head, but there is absolutely no correlation to anything, even genetically, other than repeated blows to the head, which is why NFL players are at such a high percentage of CTE data research. So lifestyle. So the article discusses lifestyle factors like alcohol abuse, recreational drug use, and performance-enhancing drug use, which are common in athletes and military veterans. Military veterans also a high percentage of subjects found to have had CTE. These can also contribute to these personality changes and the difficulties with everyday life, with the motor and cognitive symptoms, which we discussed earlier. And they may overlap with the symptoms of CTE, which also makes this disease tough to diagnose. Many individuals with neuropathologically confirmed CTE have a history of substance abuse or other lifestyle-related issues. There are also cases of CTE with no history of these behaviors, indicating that substance abuse is not a causative factor of CTE. There is some correlation with alcohol and drug abuse with subjects who have been found to have had CTE, but there is not a direct link between the two. Like I said earlier, the only link for CTE is head trauma, repeated blows. This article on Dr. Ann McKee and Clifford Robbins' research emphasizes the importance of understanding whether and how lifestyle factors influence the clinical manifestations of CTE, as these factors complicate the accurate diagnosis and understanding of the disease. Public perception. The media has portrayed the people who have been found to have had this disease as cold-blooded killers, monsters, horrible decision makers, immature people, and there is no defending the acts of people who have had CTE, as most of them end up taking their own lives, and some even lives of other people. But the public perception is definitely wrong about the people who have this disease, and that starts with the lack of understanding of this disease. Even Dr. McKee and Dr. Robbins, who have researched this disease and have looked at many statistics on it, do not fully understand it, simply because it can't be diagnosed in a living person and it cannot be cured. The increased media attention, because this deals with high-profile professional athletes in most cases, the media is getting a hold of it and they're run with it. And this disease has caused an uproar in the NFL over the last couple of years with head injuries. The NFL is really cracking down on penalties, on helmet caps, to try to reduce the impact of some of these hits and unnecessary blows to the head. And also public confusion, just the lack of knowledge of this disease and of the people which the media are portraying. They don't know these people personally, and they don't know their personality or their characteristics to understand how this disease has changed them as a person. The implications for public health. The affected populations. Most CTE studies focus on contact sport athletes and military veterans, not just Dr. McKee and Dr. Robbins' research, but most research in general. Mainly on contact sports in general, but also these military veterans. As we spoke about earlier, the alcohol abuse, recreational drug, performance-enhancing drugs, there is some correlation with those issues and CTE, but the extent of it we are still unsure about. The overlap with the symptoms. These conditions can independently cause personality changes and neuropsychiatric issues. Some CTE cases occur without any history of substance use, and these factors are not directly related. They're not directly related, but there is some correlation to an extent between alcohol and drug use and chronic traumatic encephalopathy. Call to action, enhance research efforts. There is a bunch of research being done. There are more research symposiums which are beginning to include studies done on chronic traumatic encephalopathy to educate people about this disease and the issues associated with it. There's been an enhancing of diagnostic tools. Dr. Ann McKee is leading the efforts in chronic traumatic encephalopathy research, and she is the main doctor who is really trying to increase the education of this disease. Prevention strategies. Also, like I said, the NFL is cracking down on penalties and unnecessary blows to the head. This disease is not caused by 2 or 3 big blows to the head. It's more of an accumulation of an athlete playing this sport throughout their lives, and the small accumulative hits to the head are what is ended up causing CTE. And also just basic education and awareness. This disease can be taught in school, just like we discuss dementia and Parkinson's in some science classes and some anatomy classes. CTE should also be incorporated in school, I believe, as well as Dr. McKee and Dr. Robbins believe as well. So here is Dr. Ann McKee and Dr. Clifford Robbins. like I said, Dr. McKee is the main person who is leading the efforts to educate people on this disease and the issues that it causes. And she is also not defending the subjects who have made bad decisions and been found to have had CTE, but she does attack the disease itself and says that it is obviously a disease that will change a person's personality, a person's thinking abilities, and the decision making. And Dr. Robbins has agreed with Dr. McKee. He is helping lead these efforts, and they are both doing great work, I believe, to try to raise awareness for this neurodegenerative disease that is changing the lives of many contact sport athletes. Do y'all have any questions? Okay, thank you.